My name is April Boyd. I'm a vascular surgeon, basic science researcher, and professor of surgery at the University of Manitoba. Today I'm going to be talking about how to present your basic science research to a clinical or naive audience. We all know the excitement that comes from basic science discovery, but oftentimes we have difficulty conveying the significance of this to our clinical colleagues, or at times when trying to obtain funding for research, explaining to a naive audience the significance of the work that we're doing and the implications that it may have for future research and for product development. If you start off with an attention-grabbing statement, that's important. Say you've been asked to give a presentation in the middle of a clinical meeting because you've won an award, and you get up to the podium and the audience hears that it's a basic science topic. Sometimes that clears the room pretty quickly. But if you have a statement, say, for example, today my research is going to explain why bypass grafts eventually fail, that will catch your audience and you may keep more people in the room. It's important not to overwhelm your audience with too many acronyms or too many chemical names when you're presenting your paper. Keep it to the point of the presentation. Your audience does not intend to replicate your experiments. Highlight the potential for clinical significance because that will catch an audience's attention. You may not be at that level yet, but the basic science work you're doing may have ultimate implications for vascular surgery patients. In a 10-minute presentation, I generally use 3 minutes to develop the problem and describe the hypothesis and rationale for the work that I'm doing. 2 minutes for methods. Again, keep it simple. The most important part of your presentation is the results section, and your slides should be so clearly evident as to what you've done. Your axes should be well labeled. You should avoid color combinations that vibrate, such as red on green. If you're colorblind, you can ask a friend to check your slides over before you start to make sure there's the optimum contrast. You should avoid very stark slides and, of course, overcrowded slides. That's good advice for any presentation. And generally, we like to keep 1 slide per minute and 1 to 2 concepts per slide. If you want to make sure that your presentation is fully up to scratch, you might want to present to a friend who is naive to medicine and see what they understood from your presentation. If they're able to understand the project in relatively simple terms and ask good questions, then chances are your vascular surgery clinical audience will have a better understanding of your presentation. You want to practice the presentation, but only to make sure you stay within time guidelines. You do not want to read your presentation or to practice it to the point where you sound like a robot. It's important that if your second language is the one you're presenting in, that if you're stumbling on chemical names or important molecules that are part of the project, that you practice those words to improve them, and if not, use the short form after the original presentation of the word. There's a modern phenomenon among young men and women right now called vocal fry. This is where the person tends to have the quality of voice of an elderly person. It tends to be somewhat crackly. And in presentations, that often leads the audience to believe that there's sort of a lack of confidence. A similar phenomenon is to rise at the end of a statement as if you were saying a question. So it's important if you do these things and you do you can videotape your presentation and see if you're a person who has either vocal fry or who rises at the end of statements. Recording your presentation is also helpful because if you're a person who uses or ah or filler words such as okay, you can make a conscious effort to take a breath or to pause when you would otherwise use those words and try to eliminate that from your presentation. It's important with your work to finish on time and finish on a high note. You want to leave the audience with the last most important finding of your work. Make sure you thank collaborators, but not an exhaustive list of everyone in the laboratory. And when you're asked questions about your presentation, remember this is a clinical audience or a naive audience. The questions will not be the same level that you'd get at a basic science meeting, but please be gracious and answer the questions. You always can leave the audience wanting more. Anyone who wants more fine detail about methods will seek you out in the auditorium later on. Thank you.